as a consumer, recognize all these people that you meet in a hospital or a medical situation. And these jobs are also in demand. Each one could be a stepping stone to nursing. Each one is a stepping stone to some other level of healthcare. And few of these require a bachelor's degree. So this was our focus. Now, the components of the network, as I'm sure many of you are aware, the barriers keeping low-income people from securing jobs with adequate wages, to make it worthwhile to work. I think sometimes we don't think about that enough. You know, just getting a job, like, well, of course everybody wants to do that, it's a good thing. Well, yeah, but it's got to be worthwhile. It's got to give you something in return for your effort. And then even to be able to see these possibilities of advancement. The barriers to that, you know, are legion. Consequently, there are few organizations that can address all these barriers with one program. And what the Allied Healthcare Career Network does is to acknowledge that reality and to do the following. First, evaluate the barriers that each member organization addresses most effectively. So a place like Erie House, we are adult educators. We're good at that. Are we job trainers in terms of the actual skills in the healthcare industry? No. But there are other organizations that are. And so how we link all those organizations with their best skills is what we're trying to do here. And now we need to evaluate the applicants for what each is the best starting point for them. Some people in our community who speak little English yet, clearly that's step one. But it can't be an isolated step. In other words, their reason they come to us is not to learn English just because that would be a nice thing. They want to get a better job. So the sooner we can make the connection between an ESL class and a place in the workforce on a career ladder, the better off they are and the more successful we'll be. And then the part of the network that really, I think, turned all of us on was the notion of really having not just, oh, we could refer you somewhere when your needs don't fit ours, but we're not referring you somewhere. We're referring you within a connected system of providers who all know each other and who agree to serve each other's community members. And then also that we would lay out for everyone, as I said, what the career steps are so they have a sense of where they are at the beginning, the middle, closer to the end. And that we would, most importantly of all, facilitate navigation through this system. We have a position in our proposal called the System Navigator. I actually wanted to call it Shepherd, but that was a little too bucolic for an urban program. But that's what it's kind of like, is you have to shepherd people through the system and help them find the next step. So this program, now I'll move on to the end here, but just to give you an idea. So what's involved in getting people who are significantly barriered to a point of a good job in the healthcare industry is to have opportunities for vocational English, adult basic education with a vocational track, bridge programs that link people from adult education to skills training programs, good skill training programs, and finally, of course, job placement assistance. All of these are now part of our network. And the network itself is to be governed by a steering committee of member organizations with a paid network director. And this is one of the things that I always try and hammer in about collaboration. It's a great idea. You can start out informally, but if you plan to do serious work over the long term, there better be somebody paid to make that happen. We will also utilize software. Bob was talking about having metrics, being able to document, measure your performance. There's a software out there now called ETO, Efforts to Outcomes. A number of us already have that system, and this will allow, again, a collaborative to share data and be able to monitor each other's performance. But the big question on the table, it's the 500-pound gorilla in the room in all these situations, is what if we don't get the federal grant? And frankly, to apply for a federal grant, you have to be, what Rogers and Hammerstein call a cockeyed optimist. Because you look at it, you say, well, yeah, there's millions of dollars. To all of us in the neighborhood, that sounds like a lot of money. But then they say, well, there'll be 17 awards. And you think to yourself, okay, well, there's 50 states. So already 17 awards isn't even one per state. Nevertheless, this is the big money, so we have to try. So you go at it with an optimistic point of view. But on the other hand, as community development people, we're also realists, and you have to have plan B. And so we decided early on that while we would not be able to fund some of our wonderful plans for expansion that $5 million a year would allow us, that we should make every effort to stay committed to the network concept and strategize on how we might be able to even fund it at a more modest level and continue to take this proposal, this whole thing that we developed, and shop it around to other places as well. Well, I mean, the good news is that, in a sense, the ink wasn't even dry on our federal application, and one of our private funders, I hope they don't mind me mentioning, the Fry Foundation, who happens to give grants to all 5 of us who are in the network, heard about, from one of the members, this effort of ours, and she said, I want you all to come and talk to me and tell me about this. And so we said, oh, okay, fine. And so now they're very committed to funding not only us individually as grantees, but to fund the cost of the network as well. Not completely, but they're going to also try and get other funders engaged to do the same thing. So moral of the story, I guess, is, and we probably have, the clock is ticking, what's today, September 16th. Whether we get this federal grant or not, we believe we've created a better instrument for place-based community development in the workforce system, and that we may, in fact, have opened new doors for capacity building among some other local funders. Thank you.